push the button. Good morning, everybody, and welcome to the Medicare Cafe pre-chat. I am not starting out good
the pre-chat
with the words this morning. I am on a struggle bus of struggle
The slide
buses.
was up. They could read.
Just as
It's
fine.
the pre-chat.
And it looks like our microphone levels are down. Let me pull this closer. Nailed it. All right. So,
Is that better?
I think so. So good morning, everybody. Welcome to the pre-chat. Before we get started today, at the top of the hour, I do want to remind everybody that today's Medicare Cafe topic is going to be an AMA, aka Ask Me Anything.
Ask me anything.
Ask me anything. Now, let me make sure. So before we get started, I'm going to make sure we're using the right microphone because these levels are fairly low. While I do that, I know, Carrie, you and I were just kind of talking about you just received a voicemail from a client who is on a med sup right now.
Yep. I got a voicemail from one of my clients who he said, hey, with the cost of inflation and just everything, as I'm sure everyone is feeling, everything going up, he's like, I just really need to figure out if I can stay on this supplement and PDP. And so I called him back and I said, let's meet. I didn't want to just have this conversation over the phone because I could just sense the stress in his voice. And so we're meeting on Thursday. Really just, he was asking, is it time for me to reevaluate and switch to a Advantage plan? And so I'll have to check back, in my CRM at my notes, but I'm pretty certain this guy has several pre-existing conditions. And so, that's just something that we're going to really have to weigh. If it, yes, you're paying more upfront in your premiums with the MedSup and the PDP, but let's look at your health situation. How much are you using your health care? Are you going to the doctor every month? Let's look at the pre-existing conditions. I'm pretty certain that when I originally met him, he had cancer. And so, I'm probably going to tell him what he doesn't want to hear, but that it still might be more cost effective for him to stay on his MedSup and PDP rather than switch to an Advantage plan. But, my plan is to tell him he can't switch right now anyways. It's not open enrollment. So let's just, I'm going to show him all the facts and then let him kind of just reevaluate until Medicare, until AEP. So,
and again, I think that's really such a hard thing. I read a study the other day that said because of all the inflation, again, we're seeing like a 14 to 16% inflation since 2020. And I think I read something the other day that said for the average American to just have a lifestyle that they had last year, they need to make about $5,100 more this year just because of the cost of living and everything. And so, a lot of these people are really considering like where can I save money?
Right.
So I think like
I'm doing it. Everybody's doing it, not just seniors. And so I can imagine like if you're paying a lot in health premiums, you're looking back everywhere where you can cut.
And again, there's so much information about like, hey, there's, these Part B givebacks, get more money on your Social Security check every month, or get free this, free that. So those Medicare Advantage plans are more appealing than ever for those
Sorry,
individuals.
we're playing footsie over here.
I liked it. For those individuals who are struggling with like, and not even struggling, but just like, hey, gas is costing me, to fill up my 20-gallon tank, it's over $100 to do that. So just making sure that, again, I also think like, of course, people are looking to cut costs, but like don't forget about those ancillary products. What's the first thing to go when money starts getting cost? It's those things that they're not using.
Right.
Your final expense policies, they're at risk right now. Those cancer plans, they're at risk right now. Things that like you need to have them. People need to have them for protection because imagine getting diagnosed with cancer right now.
Exactly.
I mean, to travel back and forth from the cancer centers, staying in hotels, literally everything that comes with getting cancer has been the most heavily affected by inflation. But when somebody's saying, hey, I don't know, can I afford
their premium?
Can I afford this premium? That's the first thing that's going to go.
Right.
So.
And Michelle, you asked about the Missouri anniversary rule. I'll talk to him about that too. I couldn't remember off the top of my head what his effective month was, but even at that, he specifically asked about an Advantage plan, and if we were to switch him, it might be, I don't know if a $5 or $10 change per month would be substantial enough for what he was thinking. But yeah, we'll consider all of that. Great idea.
I think it's really important to note that, like, literally everything it's telling them to switch.
Yeah.
Everything is saying, again, look at all the Joe Namath commercials, all the things they're seeing during Andy Griffith. Everything is saying, like, hey, you need to talk about a Medicare Advantage plan. Money's getting tight. So it's, you know, like, yes, they have their expert, but they're being constantly inundated with this messaging that's telling them the opposite of what's best for them in that situation. Now, Stacy asked a question, what are our thoughts on the Part B in 2023? It's supposed to be lower than in 2022, but will that be offset by inflation? So one thing I will mention about the Part B is that there was a medication that was really attributing to such high cost of Medicare Part B. And it was decided, and I can't remember if it was
what was the medication?
I can't remember. I hate that I didn't bring this up. There was a medication that was basically saying this medication is going to be covered under Medicare Part B. So that's why the Part B, that's why Part B premium was going up. It was a significant reason as why Part B premium went up so much. That medication is not going to be covered by Medicare Part B. It is going to be covered by Part D, as in dog.
It's not Prolia, is it?
No, it was some crazy long name.
Oh, okay.
So they're saying that is going to be a medication covered by Part D, so Part B is not going to have to cover those costs. At the time, it was supposed to be, let's reevaluate the Part B premiums. I don't think that happened. And so I do really think that, yes, Stacy said it had something to do with memory care. Yes.
Guess we need to take it.
Oh, she's on it. I see the irony. So that is something that, so they are saying on top of everything else, plus the Medicare got a huge flack for having such massive Part B premium increases. Yeah. I've been studying and watching this since 2013. I've never seen Part B go down in premium, but I have it stayed the same.
Steady.
Yeah, it's been like, I remember back in like from 13 to like 16 or 15, it was that 104.19 for like 3 years in a row.
3 years in a row?
Yes, it was a crazy. So I can't imagine, and Benjamin, was this the whole, yes, Benjamin, that's exactly what we're talking about. So I don't know that I can see it going down, but potentially like staying at the same. I do think that is a
which ultimately with the cost of living adjustment, you know, their benefits could go up. And
so interestingly enough, when cost of living is calculated, it's actually calculated really strongly off Part B premium. COLA comes out after the Part B premium is announced. So if Part B premium doesn't go up a ton, the cost of living, like the cost of living adjustments, will not see a huge increase either.
Okay. I was thinking it was the opposite. That the COLA.
I've always known that like Part B comes out first, then COLA comes out to adjust with that.
Interesting.
We'll double check that.
Yeah.
So, anyways, so there's some fun information, and honestly, a great way to get us kicked off on today's topic, which is a Ask Us Anything. So we do this every couple months, or right now we're kind of doing it once a month because of all the crazy things going on in the industry. Yes. But welcome to the Medicare Cafe.
So good morning. Happy Tuesday.
Medicare Cafe. We have our blue light.
My head's kind of blocking it today.
I like it. So I love it. Did your daughter ask you if you were doing your podcast today?
Yep. Oh, she knew it. I put on that headband.
She's like, it's podcast
Mommy,
time.
Go podcast. Yep.
I love
I'm
it.
going.
So welcome, guys. Today is an Ask Us Anything. So if you have any questions that even has to remotely do with our industry, feel free to ask Carrie and I. You have both the perspective of industry-wide FMO knowledge, as well as Carrie, who is out there pounding the pavement and is making her income by writing consumers. So you have both sides of the same coin here. We're really excited to share with you some industry knowledge. 2 ways to ask us questions. Yep. Feel free to do it on the text messages below.
Line. Sorry, you were going to go with that first, and I was
like
pointing.
This. We're on the same page this morning.
Good.
We're killing it.
Yes.
So feel free to text us your questions by texting below. That is the Medicare Cafe hotline. Or feel free to ask us questions in the comment section. Now, if you are watching the recorded version of this, because we record all of our episodes, you can still go ahead and text this number or message us on YouTube. You just might get a slower response.
Yep.
So
we already have some questions, or I guess they're still about the Part B that we were discussing.
So again, Stacey,
I'll let you say that big word there. As you said, it was a quite a long one.
Abracadabra.
Abracadabra.
The medication called Abracadabra.
Let's go with that.
Received accelerated approval as a treatment for Alzheimer's disease in the FDA. That is the first FDA-approved therapy to address the underlying biology of Alzheimer's disease. So yes, again, that's that medication was 100% one of the main causes of why Part B was seeing such a substantial hike in premium. Yeah. So just keeping that in mind, again, maybe attributing to what's Part B going to look like for 2023, that premium, I think it's a good possibility that that's going to stay
the same.
Now, and again, we didn't
Fingers
see COVID-19, we didn't see nearly as many hospitalizations in 2022 so far as we saw in 2020 and 2021. So fewer hospitalizations and fewer doctor's visits are going to mean that medical expenses are going to be less for Medicare and CMS. So that could also, part of the reason why Part B premium went up so much is because doctor's visits and doctor utilization went crazy in 2020 and 2021.
I think did you see the NAHU article? I think it was Sadie and I that were talking about this. That in 2020 was the first year that Medicare expenses went down because so many people were staying at home and they weren't going to the doctor. There weren't preventative services. It was the first year in 3 decades that they said that it actually went down by 6. It went down by 6%.
That's insane.
The other times it's gone down, it was by 0.5%. So it was a huge decrease.
So a lot of people were not utilizing their preventative services, colon screenings, breast cancer screening, things like that.
Or they were doing it telehealth, which obviously doesn't cost nearly as much.
That's a very interesting factoid.
Yeah.
But imagine what's going to happen. People are going back, so we're seeing
it's gonna go
cancer diagnoses are going up because people didn't get their pre-screenings, things like that. So a question that Stacy had, any tips and tricks on the AHIP that was just released? Really, I love that, Stacy. Great question. So the first thing when it comes to tips and tricks on the AHIP, I know, first of all, they're never fun.
No.
Have you, it was released
rip
yesterday.
the Band-Aid off and do it.
My number one recommendation is wait until the carrier certifications get released, because carriers like Aetna, UHC, Humana, they will give you up to a $50 discount to do those certifications. So wait. I also will say that every single year there are pretty significant issues and bugs with AHIP. So wait until they figure some stuff out. Let those early bird worm getters figure out what the issues are, and then that's when you take the AHIP. The first people always get some issues.
I always wait until the carriers. You can do it through the carriers because of that $50 give back. Always.
So, actually, next Monday, United Healthcare will release theirs. The next day, I think it's Aetna. The next day is Cigna. So, next week is when most carriers will release their certifications. So, get those out of the way.
And I feel like it just once you do AHIP and then move on to your carriers, if you're in that mindset, I just feel like it goes faster because you're answering some of the same questions.
True.
So if I think my first year I did it, I tried to spread it out to make it not as daunting, and now I'm I hammer it out in 2 days when I'm answering the same questions kind of over and over.
So you recommend, instead of doing, this week I'm going to do
That's what I do.
Next week I'm you just do them schedule out 2 days.
Yep, I try to hammer them out in 2 days.
I think that's a really good idea, because there is a mental mindset you have to be in to get those done.
And then if you just drag it off, I just feel like you're just going to keep dragging it on.
Yeah, I'm a procrastinator for sure. Also, make sure that most certifications do allow you to download the slides ahead of time.
Yes.
So download those slides, and it's like an open book test. So utilize Control F to find keywords.
Absolutely.
And anytime they give you questions or practice tests, take a screenshot of those practice tests, because they're almost always the same questions in the test.
Yep.
So, and that's with both AHIP and carrier certifications as well. It's an open book test, so make sure you're saving those slides. And of course, call our office, and we're more than happy to help you guys. We're not going to give you answers, but we're more than happy to help you guys with your research and things like that.
Stacy also asks, NAHU is full of important industry info. Would you recommend independent agents have a membership, or is that something an FMO would offer / help us with?
Yeah, I really do appreciate NAHU.
I do too.
Are you a NAHU member?
I am. I have been for about a year. I haven't actually been to any events. Just last week, I told Clint I wanted to get more involved in it because if you want to, this was actually one of the questions that somebody asked us beforehand, was where do you get your Medicare knowledge? Aside from the Medicare Cafe, I read NAHU's daily Medicare snippet email that they send out. It just has really good, like you said, industry information. So even if you just become a member to get those emails, I think it's incredibly helpful if you want to get more involved. They also have like committees and different boards that you can be on. So yes, I mean, you can talk about it from an FMO standpoint, but from an agent side, knowledge-wise, it's incredibly helpful.
So NAHU does two things that I really love on an agent level. I think one thing that they do is they connect agents to each other. And the networking aspect, especially when you're an independent agent, you don't have, somebody to go and talk to a lot of times or ask questions to when you just want to talk to another agent. So NAHU does offer a really awesome availability for networking and to just get out there and meet like-minded people.
Yes.
I will say traditionally NAHU has not been a Medicare friendly or Medicare focused organization, but they're really making efforts for the last 5 years, have made significant efforts to become much more Medicare individual focused. In fact, NAHU is the reason behind the 48-hour scope of appointment rule. That was because NAHU got behind the legislation to remove that to where it can be same time as the appointment. NAHU is also working on significant things to make sure that COBRA becomes credible coverage for Medicare Part B. They're also behind whenever the Medicare...
I didn't realize that. That's awesome.
Yes, and the Medicare Part B to make it to where you can sign up, if you're signing up during the general election period, making it to where you can sign up and it's effective the following month, not in July. Yeah. So NAHU is behind a lot of legislation that is pushing that. So it's really awesome to be involved in it for those two reasons. So again, the networking and just the work that they're doing to make agents' lives better and consumers' lives. So
can I ask a question now?
Please, yeah.
Elaborate on that Part B in COBRA.
Yeah, so there's right now they've been working on a long time to make COBRA credible for Medicare Part B.
I did not realize
Still
that.
not happening yet. It is credible for D, not credible for B.
Right.
So they've been working on that for quite some time. In the meantime, something that they did get pushed through, and I think this will become effective in 2023, is that whenever you're signing up for Medicare Part B and you're not in an election period, you have to do so during the general enrollment period, they're saying that you'll be able to actually enroll, and instead of it being effective July 1st, it'll be effective the following month. So making it to where if you sign up during January, it'll be effective in February.
Yeah.
So they're making really good strides to
That's awesome.
To make the process more simple and making sure the beneficiary has a better experience.
Especially, I've hated when I've ran into somebody who's on COBRA that just they thought they were doing the right thing. And it stinks when you have to tell them, well, it's not technically credible coverage.
It happens all the time. Yes. And unfortunately, there isn't they say, oh my gosh, what is it called whenever you're there's ignorance is bliss.
Oh, yes. Yes.
That was hard. In this case, ignorance is not bliss. You do not get any
nothing
treatment.
In the Medicare world that
for some reason this actually did help.
Okay. I was trying to, while you were talking, I was like, what is on your finger?
Oh, it's my
it's your hair tie.
It's my hair tie. That's distracting. We do have a couple text questions as well I wanted to get to. And one of them was from Terry. He says, Olivia and Sadie did a marketing presentation the other day. Do you or would you do events with financial advisors? And I'm actually going to turn this over to my financial advisor expert, talk about how you utilize, how you actually make a killing off doing events with your financial.
So I guess a follow-up question, is the marketing presentation, are you marketing to build those relationships or put on an event with the financial advisors for their clients?
I'd say let's talk about both of them, because Sadie and I last Thursday did a unique marketing idea webinar, and it talked about some doing events and how can doing events help you build your business. So I think what it comes down to is there's two types of presentations. One that is a financial planning, to educate the financial planners, and then another one to educate the financial planners' customers.
Yep.
So talk about because I know you do both of those.
Yep, I do both of those. So, I've built my business by connecting with financial advisors on a personal level, and initially will try to sit down one-on-one with them and build that trust. But then what I have also done is, for instance, Edward Jones, they have, I think it's quarterly, they have quarterly like all advisor meetings in their areas. And so I have spoken at their educational events. They had somebody from Social Security talk, and they had me come in as the Medicare piece. So I had a whole, for me it was marketing, educating them on Medicare, and that has become I don't know, I should know the number of how many Edward Jones advisors I work with. But, they now send me all of their Medicare business. But I also, something that they also did through COVID that was client-facing, when they knew people were stuck at home, they started hosting monthly educational webinars for their clients. And so then they had me as a Medicare piece for their clients. They also do financial advisors. Many of them also hold like client appreciation events. And sometimes I've spoken at those. Those are more client-facing, but there's a ton of different avenues that you can go with financial advisors, but there is such and I talked about this before, there was a whole article about how it's the blind spot, and the blind spot in financial advising is Medicare. And so it's an absolute great avenue for your marketing and just business building to connect with financial advisors.
What do you find more profitable? Do you find it better to actually do the presentation to their clients, or do you find it more profitable to do the presentation to the advisors themselves?
The most profitable is both.
Okay.
So is when favorite thing, when I first set up a meeting with an advisor and they want to refer a client to me, I will request that we all meet in their office and that they see me present to their clients. So that way they're getting the full spiel. They're also seeing that I truly am an expert, that, I can, obviously I don't know everything, but, most of the questions they throw at me, they'll just see my breadth, what's the word I'm looking, breadth of knowledge? Depth. But there's also like a breadth.
I think you're right.
But
we talk for a living.
Yeah,
this is what we do.
The breadth. So yes, having a meeting with both of them is what I've realized is the most profitable.
Very cool.
And successful as far as the relationship thriving.
Yeah. So to answer your question, Terry, do them. They work.
Yep, they do.
Looking at some more questions we had, Tammy said, new to the industry, please explain some of the major special enrollment events for Medicare Advantage. The best way, in my experience, that I can always say, like, should a person qualify for a special election period for Medicare Advantage and Part D, is I always go back to something I actually picked up when we did ACA, which was life change. Was there a significant life change that would affect their health care? More times than not, if that's answered by yes, then it means that they qualify for some sort of special election. The most common ones that I come across is losing credible coverage or losing an employer-sponsored health plan, moving into or outside of a service area, so moving counties. Moving in or out of an institution, so talking about like a nursing home coverage. And
those are the three I was thinking
of. Those
those
are the top three that I run into. There's also things called Trial Right, Trial Right 65, which we're seeing a ton more since 2020, a lot more utilization of the trial rights. And that's it. That's I mean, there's dozens.
More than that, right?
There's dozens, but those are the most common that I come across.
There's also a veteran one, right? There's one, it's like OIEP.
There's one like there's the one that if you delayed Medicare Part B, then you can get, not with the drug side, but you can get a Medicare Advantage plan.
Right. There's a veteran one. I'm going to have to look at that one. The
best way that I always tell people to do is that senior marketing specialists, there's two resources that I recommend. Number one, senior marketing specialist, I call it the SEP calculator, but it's also actually called like the SEP enrollment tool or something like that.
Enrollment tool.
Yeah.
I think that's what it is.
And so it's on Senior Marketing Specialist website. If you have one contract with us, you have access to it. But I like it because you literally answers like does one of these multiple choice questions, does one of these apply to your client? Yeah. Yes. Okay, if yes, does this. So, like, it's kind of like, I think Rachel Brandmeier always described it as a choose your own adventure. Yeah. It's always just kind of like you click on it, and it eventually, when you answer all the questions, it eventually says, here's your SEP.
And these are the dates that they have to enroll by. It's very helpful.
I love it. That's what I always recommend. The other one that I like a lot is United Healthcare publishes a special election booklet, but you have to kind of research it. And it does a good job of kind of putting it into layman's terms as well. So either one of those would really help you. The biggest thing I can say is remember that Medicare Advantage special elections and Medicare Supplement Guarantee Issue are not the same. Right. They do not coincide with each other
at all.
For example, if somebody loses Medicaid and they're in like Missouri, for example, if they lose Medicaid, that does open up a special election for Medicare Advantage and Part D is not guarantee issue for a Med Sup.
Right.
So that depends on the state. So just keep that in mind. Some more.
NAHU membership looks to be for $460 a year. Can anyone confirm that, or if there is?
I'm double checking. We actually have several people who sit on the NAHU board. I'm a NAHU member as well. I actually have we have several people who sit on our local NAHU chapter board. I'm texting them and asking them how much is a NAHU membership per year. So I'll find out.
I mentioned that somebody had asked me earlier about where I get my Medicare knowledge. Where do I go to learn more about Medicare? Aside from NAHU, I don't know. Are you familiar with the Medicare Learning Network, the MLN? So it's a, I don't know if you can see this. So it is a, I guess, link from CMS. That it is amazing. It's called the Medicare Learning Network, and they have all of these, like, they call them fact sheets, that there's hundreds and hundreds of these.
And
they're almost just, like
branded?
Simplified. They're government branded.
Oh, so you know, like, it's credible.
There's dates on there. So this one's May 22. Like, the date it is. So this one specifically is on Medicare diabetes self-management training. Like, it could be about anything.
Wow, I've not heard of this.
They are, so not all of them have these fact sheets, but you can just download these. It's almost like what you would think of like a little, just a little brochure. It puts it in simplified terms. It has hyperlinks on it also if you're, on a smart device or whatever and not just printing it out. So that is a great tool for me.
I love that. Again, that's something we always, anything that has a .gov or has the CMS logo on there.
Oh, yeah.
I love for agents to actually give those to clients because it builds your credibility.
It does. I mean, the government's language is way stronger than ours.
Oh, I love that. I learned something.
Yay.
I love it. A question we got, and I think it's going to answer some other questions we have here, but a question we got via text message was explain lead generation and what is kept for the 10 years, the actual application. So we talked about this a little bit last week in what was known as the chain of enrollment. So anything that could possibly lead to a sale of a prescription drug plan or a Medicare Advantage plan, so anything that could possibly lead to one of those sales has to be kept on record for 10 years.
For instance, my voicemail from my client that just said he's on a Med Sup and a PDP, but he wants to hear about Medicare Advantage. That's got to be recorded.
Absolutely correct. You need to keep that voicemail on record for 10 years because that could very potentially lead to the eventual sale of a Medicare Advantage plan. And so we talk about this a lot, like lead generation. So if you're doing a mailer, if you're doing a T65 mailer, a dental vision hearing mailer, I don't care what mailer it is, if it will potentially lead to a Part C or Part D application being taken, that has to be kept for 10 years.
So basically everything.
Everything.
Cover your butt.
Exactly. So making sure you have a really good CRM that will have storage, or what we're seeing a lot of agents do is actually purchasing external hard drives with 1 to 2 terabytes of data, and just making sure that everything gets uploaded to there. Now, reminder, you need to make sure you have that storage, but that you'll need to be able to pull upon those pieces and those recordings if a carrier ever performs an audit. Why do carriers perform audits? Typically if there's a complaint filed to Medicare. So it's in your best interest to keep all of that stuff on file.
Michelle says, I'm so concerned about HIPAA with the chain of enrollment.
Yeah, and I think that's really fair.
Yeah, I agree.
And because, again, the one thing you'll want to make sure you do is the biggest part we were talking about with HIPAA is going to be security of storage. Yeah. So making sure if you are storing that something in an online cloud-based system, if you're using the free version of that, I can guarantee you that's not going to be
double
HIPAA
password
safe.
Protected, right?
Two-way authentication. So typically, like, it needs to require like a text code be sent and a password or something like that. So making sure everything is double protected, you should be fine.
Yep.
Some more questions.
Got lots of questions.
I know. Thank you guys so much for participating. It's so much more fun whenever you guys join in the conversation. Stacy also asks, as a new agent, I'm a bit overwhelmed and excited about how much training is out there for FMOs, carriers, and websites and the general internet. The biggest, so I want to lean this to you because you were an agent out there who had to partly learn as you go, but a lot of it can be overwhelming. My number one advice is to say, have a goal and find something, like, don't try to learn everything at once.
Absolutely.
Bite-sized pieces. Learn one aspect. When you feel like you have that, then move on to the next. But what helped you when you were starting out?
I agree. Honestly, well, and I guess it's hard. I had the benefit of I'm working with other agents. And so to me, like, you learn the best by just experiencing.
I love that.
And so I experienced through other agents sitting in on their appointments, hearing the questions. And also one of the things that I did when I first started was educating. The more you, like, teach it yourself, the better you're going to learn also. You learn so much through teaching. And so I don't know if you... what was your specific question?
It was like,
for
do you have
new
any guidance for new
define
agents?
Training from their upline.
I think for me, you nailed it on the head. I work with so many agents who honestly at this point know more about Medicare than I do. And I know a lot about Medicare, but they've never written an application.
It's the real world questions that are going to make you say, you know what, I don't know that answer, but I'm going to look it up, and you will never forget a question that you did know the answer to. And so just having those constant real life questions. I actually, and this is the nerd in me, I think for my first year, I kept a spreadsheet of, like, all the questions that I didn't know, because I was like, oh my gosh, if I get asked this again, now I know it.
I did the exact same thing.
Really? Oh my gosh, I love it.
We actually had something called, like, the brain. And I know actually Rachel Brainmeyer actually started it in her first year with insurance.
Really?
And so we all just be like, I've never been asked that before, and we just put all the questions we didn't know answers to into one document. I think it's great advice. I love that. I would say just basically make sure whenever I'm working with new people, I say don't memorize answers, memorize resources. Because you're not going to remember everything. Just remember how to research it.
Yep.
And so making sure you have the live chat function for senior marketing specialists, so that if you are with a client, just jump on live chat. You can ask us. You know, that can be your research. And making sure you know your resources like Medicare.gov, carrier websites, things like that.
The other last tidbit of advice I will say is something that has helped me, and I still do this, is I almost run through my appointments before the appointment. Just to make sure, you know, if I'm meeting with somebody in a new state, I will run through Medicare Center pretending like I'm with them right then, in case there's something that comes up that I'm, you know, so I'm not fumbling in the appointment. Or, you know, especially if you're on Zoom, make sure all your technologies and software and everything is good to go well before you do it, so that it's just more streamlined. And that, I mean, I feel like when anybody fumbles or sees something that causes a hiccup, like, it just stresses you out, it stresses them out. And so kind of practice your appointment before the appointment.
I love that. We actually do also have some mock appointments on our university, so you can kind of see, like, what that can look like, what kind of questions are being asked. But I think also just finding somebody who you feel really comfortable asking those questions to, and being able to have really open and honest communication. That can be your upline, that can be your FMO. Just make sure you're working with an FMO that provides tools and resources where you need them. That's again, your partners are everything in this industry.
Yeah.
We have time for one, maybe two more questions. Melissa asked, I'm not sure if it's been missed this year yet, but is there any more information on recording calls for conversations with clients? So again, that is something that is incredibly, incredibly important. It all comes back to what is known as the chain of enrollment. If there is any communication that could possibly end up in a Medicare Advantage or a Part D sale, that has to be recorded and kept for 10 years. So if somebody's calling in and asking for an appointment, if you're calling in, and it all comes to, like, are you trying to convince them, or is it going to lead to a sale? That being said, it used to be prior to October 8th of 2021, the only part of a sales process that needed to be recorded was the actual enrollment. So the voice signature. If you're doing an appointment over the phone, just the actual voice signature or the application was supposed to be recorded. It is now saying the entire sales process has to be recorded and kept for 10 years.
Melissa, last week there was our whole episode was about the chain of enrollment. So if you want more specifics, you can see that recorded on our YouTube channel.
Good plug. Killing it. When is this effective? It is effective for everything with a January 1st effective date. So October 1st. October 1st is when all of this has to be implemented.
Yep.
Now, don't panic.
More to come
on
details of how to do this, right?
Yes.
Yep.
So
what the reality looks like.
We do have confirmation that Medicare Center is building and will have a solution in time for AEP for call recording, both inbound and outbound calls. That's about all I can say right now. So more details to come on what that's going to look like. But there is a solution going to affect for the call recording. But just remember, it's not just the call recording affected. It is the entire chain of enrollment. Any conversation that is done over the phone that leads to a Part C or Part D enrollment. What is the name? What is the name of the Carrie's website? So are you talking about the Medicare Learning Network? What was that website you were visiting?
Oh, yes, the Medicare Learning Network. So Google Medicare Learning Network, and it will actually take you to CMS website. And then there's a hyperlink that you can go to that says Medicare Learning Network homepage. It's weird. It always takes me first to CMS. And then from there, you can click on, like, there's a bunch of different, there's literally like hundreds of pages of, I think you can, there's a search bar also, you know, if you want to search diabetes or if you want to search physicals or heart-related, whatever. They even go in depth on, like, billing CPT codes and stuff.
Wow.
So
I'm gonna look that up. I've not heard of this, and I'm always
the
looking
fact
for, like,
sheets are just what's really cool. Like the
cool.
simplicity of it, and if you really wanted to, like, print it off and give it to your client, you can totally do that. And it's, again, got that government logo on there.
Just remember, you can't circle, highlight, dog ears, staple your business card.
Right,
It is a government form, so you can't alter it. But I love giving government forms to consumers because it builds your credibility.
For
You're
sure.
like, oh, you're the real deal.
Does.
You know, you have what the government is saying backing your advice.
I'm really mad that I just found this like 3 months ago.
I love it.
I wish I would have had it the last 3 years.
No joke. I mean, that's an incredible tool.
Yeah.
One last question, because it looks like it's a fairly easy one. Melissa is asking, do we still have to send scope of appointments for every application we submit through the Medicare app system? Reminder, scope of appointments will still be required through all of these compliance updates. This isn't replacing scope of appointments. Now, not all carriers require a scope of appointment to be submitted with the application. They still require them, but they only require them whenever an audit is performed. But carriers like WellCare, SilverScript, and Cigna will still require that you submit the scope of appointment with an application. So, but carriers like Aetna and UHC only require them if there is an audit performed. You still need them, you just don't have to submit them every time.
What were those three?
WellCare, SilverScript, and Cigna.
Yeah.
Yeah.
Okay.
So, yes. Thank you
I
guys.
think that's all we have time for today. Thank you so
been-
much for the participation. We had so many questions. Sorry we didn't get to answer all of them.
Just a reminder, guys.
But we'll try to do this. Yeah, I think we're trying to do it once a month.
Yeah, we're going to be doing the Ask Us Anything at least once a month, maybe once every couple of months, wanting to make sure. Reminder, this Thursday we are having a separate webinar. Myself and Sadie will be talking about Agency Growth 201, finding the right people to grow your business, and what does growth in your agency look like? Is it downline? Is it admin? It isn't neither. Talking about other options for growing your agency. So stay tuned for that. That'll be this Thursday. But if you guys do have any more questions or comments, feel free to put them and ask more questions on our YouTube page or text that hotline. I will be monitoring that as well. But yeah, hopefully you guys enjoyed this.
Yes, thank you so much. I know we did.
These
are fun days. I like these.
I like.
You never know what we're gonna talk about.
That's most days. That's most days. I have no idea. I have no idea what's coming out of this mouth. Your guess is as good as mine. So I know Melissa, she said other companies don't request this, but last year we had a fax wall care and SilverScript scope of appointments at the companies, even though they did it electronically through Medicare Center. That's right, Melissa. Yeah. Again, those are a couple of the companies that require to have the scope of appointment on hand.
Yeah.
Silly.
Another extra step.
But why? Who knows? Awesome. Well, thank you guys so much. So if we don't see you Thursday with myself and Sadie doing that agency growth webinar, Carrie and I will see you next Tuesday.
10 o'clock.
We'll see you there. So until next time, guys, have fun.
Make money.
And give impeccable service. Thanks, guys.